Hello, Colin Hung here for Healthcare IT Today. I'm excited to sit down with my next two guests. Ram Chadalavada, MD, is the Chief Medical Officer at PocketHealth, and he's also the Vice Chair of Radiology Informatics at the University of Cincinnati and UC Health. Rishi Nayyar is the co-founder and CEO at PocketHealth. I'm excited to ask both Ram and Rishi about the implementation of PocketHealth at UC, and I wanted to know why they chose the solution, what benefits they have seen from using it, and what they learned from the entire process. Plus, since I had both gentlemen on camera with me, I wanted to get the inside scoop on where PocketHealth is heading over the next 12 months. Let's get to it. Ram, Rishi, welcome to the program.
Hey, thanks for having me.
Thank you. Excited to be here.
I'm excited to talk to both of you because it's always fun, first of all, Rishi, to reconnect with you. And I'm interested to learn more about your story. But maybe just for the benefit of our audience, Ram, maybe you start and just give us a little bit of your background.
Yeah, absolutely. My name is Ram Chadalavada. I am a physician at University of Cincinnati, where I'm an interventional radiologist, also the vice chair of informatics, a couple other administrative roles. But recently, I'm very excited to have a fractional role with PocketHealth as their chief medical officer as well.
And Rishi, just for the benefit of our audience who maybe didn't watch our last video together.
Yeah, I'm the co-founder and CEO of PocketHealth. We're a connected care company focused on filling in all the critical gaps in the patient journey.
Amazing. And I'm looking forward to diving into some of the aspects of your history, but certainly congratulations on your new partial CMO role with PocketHealth. Great team here.
Thank you. I'm very excited. This is something I've got to learn about them as being part of University of Cincinnati as we evaluated different patient exchange opportunities and integration of patients into their own healthcare. And I think this was a great partnership.
Now, I'm going to ask you to take me back because you were at the University of Cincinnati, or Cincinnati, sorry, is it University of Cincinnati? UC Health, okay. And while you were there, you were a customer of PocketHealth, is that correct?
That's correct. We've been looking at different various tools, I would say, for the last 6-7 years. And I think we've had a couple of impetus internally to really evaluate what's out there in the marketplace and what's patient-centric. And so, yeah, we are a customer of PocketHealth.
And so take me back. What was the trigger, or was there a trigger to go, finally, you know what, we need to do something here and specifically look for tools like PocketHealth?
Yeah, I have a great team of informatics folks. Matt Stegman is our imaging informatics. I'm on the clinical side of informatics within our institution. So we constantly evaluate different resources and products that help our patients. So I think it's bipartisan. We had a need from a patient-centric role as we were making transitions in how we handle our film room, our CD room, our discs, and patients' availability in making it accessible, the hours, personnel, and all that. And then we also had a chance to look at what modern day, current technology, as I mentioned, we're kind of looking at this from 2016, 2017, the landscape has dramatically changed. In fact, I learned about how PocketHealth was a startup, at one of our conferences called the Society of Imaging Informatics, and to what they've become now. I think one of the main focuses is it's very patient-centric, and that was a motivating factor in involving and engaging patients today, but also longitudinally.
And why was patient engagement so important? Like, what was the follow-on benefits, or what was the benefits that UC Health saw by engaging their patients more?
Yeah, I think in healthcare, we tend to look at tools that are healthcare-centric or institutional-centric. That's important, but I think the best engagement, and this is happening in society, the way patients want to look at their clinic reports, the way they want to look at their labs, their pathology tests, just as important is their imaging. And I think imaging is, we often have the CD, that's their attachment to it, but now it's, engaged in their phone, in their PC, but it's not just them. It has the ability to integrate their family and other providers that are maybe within network or outside of network, so it creates a more community.
And during your search, you said you looked at a number of different tools. What was it that attracted you to PocketHealth?
Yeah, I think no matter what we look at, we always look at the integrity of the company, the actual resources, the security clearances. All those are official checklists, but also part of it is also the engagement we have with the team, the responsiveness, and the ability and directionality of collaborating. We saw some tools that we needed to accompany our UC Health. That's the primary focus. And we saw partnership from their CTO, to all the other partners willing to uh, essentially cater. I don't know if it's the perfect word, but adjust and accommodate to the resources we needed. And I think that's an important um, part to be able to engage, have a conversation, see opportunities for improvement, and build something for us and our patients.
And Rishi, what was it like working with the team at UC Health?
I mean, it's really great to work at a hospital that a health system that has it sometimes may not feel like it, but resources, or at least like that they have prioritized the patient experience enough that they're saying, look, yes, there's a lot going on, but we are willing to lean in. And just like Ram mentioned, we obviously, it goes both ways. Yes, we collaborated and we leaned in and we configured our platform to meet the unique needs of their patient population, but we did that because they leaned back. They said, look, we're going to move at the pace that you guys move at as a scale up, as a company that's rapidly growing, and we'll share feedback. We'll help you improve the product, and especially as we grow across many other large academic health systems similar to UC Health. That feedback is critical. So it's been a really pleasant experience. We've learned a lot. We've loved engaging with the team, and it's been a pleasure working with Ram and the other clinical folks, as well as the imaging informatics team.
To that, I'll also add, we did quite a bit of homework on our end. With the institution as the primary end, where we're located in Southwest Ohio, we had other partners in our regional academic centers or non-academic centers who had engaged with PocketHealth, whether it was Louisville or Cleveland Clinic or other members, and partners actually afar who I have a relationship with in the informatics community. So kind of doing our diligence also told us this is a great opportunity and a partnership as well. So.
And now that you've been on Pocket Health for a while, what are some of the benefits and some of the things that UC Health has realized now that you're on the system?
Yeah, I think, we actually took a two-phase approach. We had some changes in our actually personnel, our so-called film room. We had a couple of folks who are retiring and transitioning jobs and roles. So we actually had an immediate need to replace the disk, or, so-called ditch the disk model. And so actually Pocket Health helped us formulate a two-phase model to help address that need. We had some retirements in October, and so we had to work 6+ months to make sure we fine-tuned, tested all that to get into shape. And we have other collaborative opportunities that we're working on for our patients in phase 2 as well.
And how did the staff respond to Pocket Health after it was implemented?
Yeah, I think our staff was very engaged. So our IT team really appreciated the cadence and the follow-up and the thoroughness. For example, we've met with members of their marketing team, their actual CTO team, the technical team as well. And I think what we really appreciated was the follow-up. A checklist matter of fact of responding to our concerns, issues that patients have brought to us. And also, it's great to also see some of the compliments that our patients recognize as well. We thought this is a great opportunity for both.
And I was going to say, so on the patient side, what has that feedback been, if you don't mind me asking?
Yeah, well, I think I can say this, but I think we just crossed this 10,000 patient mark.
Wow, okay.
In terms of patients engaging with the application and having the ability to utilize their images. I think it's a little over 8,000 images have been exchanged. So I'll be honest, I was surprised at the numbers of subscription because I kind of didn't know what to expect. I was relying on Rishi and his team to say, hey, where are we? How are we doing? I think we had a great team-based approach locally within the institution, but also the support from Pocket Health to make sure we had the right attrition, knowledge, and sharing within our clinics, actually our own radiology film room. So I'm happy to see where we are and where we're going.
Rishi, I got to ask you. So, were there any results from UC that were surprising to you?
Yeah, I think the so there's a couple of things that went as we expected. We knew that when if we because we were doing a really deep integration into their Epic MyChart, we knew that patients would discover us there. We knew that the system would work well and be highly performant. None of that, that all comes out through testing. I think what surprised us is, we have a very hands-on engagement model. We fly down, we meet all the staff. There was just an incredible amount of enthusiasm. You're going to areas like the breast imaging areas where you have the clinical staff there and the non-clinical staff just so excited, saying, "Look, like we're gonna tell everybody about this." And right from like the fellows in the reading room to the folks at the front desk, even outside of imaging, and we visited all the areas. I think there is just like this sense of patients have been asking us for this for a long time, and this makes our life a lot easier too. So that was the biggest surprise, just because, understandably, people are very overworked in healthcare. There's a lot to do. You often don't have enough staff to do it, and it's often a thankless job. We're always very patient, we're very empathetic. I don't need someone to jump up and down when they see me and say, "Oh my God, this is the best application ever." But that's kind of what we got. And I think that was very surprising, and we were very appreciative of the warm welcome that we received. And I have to think that, getting the 10,000 patient mark, maybe 8 weeks since go live now, that staff impact is a huge reason why we were able to do that.
Yeah, I mean, let's be honest. If it wasn't easy to use, patients wouldn't use it. You'd find out pretty quick if it was too tough.
Definitely, but also patients trust their healthcare provider. And if you have a healthcare provider who's saying, "Look, I know this is different than a CD, but this is something that will be good for you, and you can share it with your doctor," that goes a long way. That goes a lot further than, yes, you need the link in Epic, yes, you need the poster on the wall, but talking to someone you trust, and that only comes from a health system that has been engaged properly and is bought in, and that doesn't happen overnight. It requires a lot of work by Ram's team to educate people on, hey, this is what we're doing and this is why we're doing it, and let's give space for any questions. And if you don't have some now, we're not in a rush. Ask them next week. It's okay.
Was there anything about the UC implementation that really you saw that they did to set themselves up well for success with Pocket Health?
It's the testing, and that is not, I think critically, that's not just technical. Part of testing is communicating workflow changes to the people whose workflow will be changed, and then leaving space for issues to come up. Because if you just call someone into a meeting and say, "Hey, instead of X, we're doing Y," especially if it's someone senior, like a senior member of the clinical staff, folks will, you might say, "Okay, I'm going to go with the program." And then maybe the next day, "Oh, but what about this edge case?" And the next day, "What about this edge case?" But UC Health was very purposeful about communicating any workflow changes early, and then giving space for anything to happen, and then not being shy to communicate to the vendor, us, saying, "Hey, like this is not an edge case we can paper over. This is important. Like a member of our clerical team or XYZ brought up this thing, and how does Pocket Health handle that?" And typically we're like, "This is how we handle it." On rare occasions, we're like, "You know what, that's a great example. That's something that's maybe more unique to your workflow, but why don't we support it in this way? Or why don't we reconfigure this part of the platform in that way?" So, and that was definitely something I'll recommend all of our future implementations to do.
One of the cultures that we have in our IT team is we like them to be the pilot customers as well of the product as it was being launched and released. So, we have an amazing team of Ashley. I can think of all the names. I don't mean to leave anybody out. But, they said, "I was using this as a customer and I noticed this on the interface. And could this be something that we look to improve?" And I think seeing that immediate touch point between our team, not just in the testing environment, but also in real life environment, I think is a perfect complement to our experience. And I think not all vendors kind of have that intimate level of relationship, the ability to query, the ability to email, and the follow-up. And I'd say, I think that speaks to the relationship we had with Pocket Health and them leaning in to us.
I got to ask, what's next in terms of your implementation at UC Health?
Yeah, so I mentioned we have a two-phase approach. So phase one was to get the product tested, released, have images available, and integrated into MyChart. So we want to very much integrate and focus our energy on MyChart, which is existing infrastructure. The other thing we're going next is to actually have the reports also available through the PocketHealth app. And I know PocketHealth is doing some exciting things about what those reports will be, the ability for patients to learn what the words, medical terms means. And I think the other part that's exciting and coming is helping ensure follow-up through communication, but also potentially actionable activation to providers, but also patients themselves, them being engaged and knowing, I was asked to follow up. Is this something I should do or not? So,
Thank you for sharing that. I want to switch gears a little bit and ask you about something that's been sort of bothering me a little bit recently. I love patient experience. I love patient engagement. I am so happy that it is getting attention that it should be getting. But I'm getting a little bit worried that so many people are saying that they're investing in patient experience, investing in patient engagement, but actually not delivering on it. That I wonder if it's becoming sort of too much of a buzzword in the industry, that people are just saying it for the sake of saying it. Can you guys convince me that actually that it is really happening? I mean, it sounds like obviously at UC Health it's happening, but in general, is patient experience really improving? Are we really moving the needle?
let me share an example that we've worked with. It speaks to the leadership team that we have at UC Health, and we have a collaboration with GE Healthcare. So we did what's called a design thinking project a few years ago. Dr. Vigal, Dr. Mary Mahoney, we actually met with folks who think about designing with our School of Design, our radiology leadership, physicians, our trainees. We actually all came together to think about what a patient experience should be as they undergo a radiology imaging exam or a breast exam. How do they want the reports? How do they accept and process information? We actually had community members also involved in that process. So to me, sure, there's some buzzwords, but I think there's also a community, especially in academics and in partnership with industry, that is actually really thinking about patient-centric, using the concept of design thinking and other arenas that folks like Apple, Google, and all the other industry partners have been doing for generations. I think about the mouse, how that was designed. It involved people from IDEO looking at how somebody would use their hand to control something. So those concepts, we're a little bit later in healthcare in incorporating it, but I'm glad to see we're doing it. And this was recognized at Fast 5 RSNA a couple of years ago. We had a talk about design thinking by one of my colleagues. So I think it's well meant, and I think there's a purposeful goal.
Yeah, I mean, my perspective as a vendor in the space is that healthcare organizations, you could say a good analogy is with AI. Everyone says AI for everything, but healthcare organizations are actually quite savvy to what is the end outcome I want, and is AI the tool to solve it, and is this actually AI, or is this lipstick on a pig, or whatever it is. Patient engagement's gone through the exact same life cycle. That before it was a checkbox, the vendor would say, oh, we're so patient-centric. I'm like, there's no patient involved anywhere in anything that you build. And because health systems had not prioritized patient engagement, they weren't looking for that anyway, so no harm, no foul. What we found now is that I'd say proven just by our growth alone is that health systems are extremely savvy to what is like authentic patient engagement, what's something that actually improves the status quo, and they ask very, very tough questions with their vendor. How do you actually implement this? What happens if the patient has a question? What do you do in XYZ scenario versus ABC scenario? And I think it's very refreshing for for businesses like ours, where we focused on patient engagement for 9 years now, but truly that has been our entire business. And we use different mediums, like we use image exchange and we use follow-up management as like mediums to engage with the patient. But the reason we've been able to grow so much is because for the last several years, while Colin, you've been getting more and more frustrated with more people saying that buzzword, they're saying that buzzword more because health systems are caring more. And I view that, I'm like, that's a good trade-off. I'm like, that's fine. It's just more attention on the space. And at the end of the day, people typically procure software intelligently, especially software that is, I'd say, meaty, disruptive software like what we do, where it's not just an add-on, a little button on the PACS that doesn't bother anybody. It's a big change. For us, I'm hoping this trend continues, actually.
Well, similar to that, interoperability, because that's kind of a space you play in as well. Interoperability has been a conversation point for the last couple of decades. I, at one point, thought that we would have this wave of interoperability and we would be where the banks are today, but clearly that's not happening. And if you excuse the pun, I think what I'm seeing now is that we're having interoperability in various pockets, right? So you have interoperability with one network or one system here and another group here, an HIE there or a QHIN here. My hope now is that the success of these pockets grows big enough where one day we'll wake up and go, oh, wait a minute, actually we've done it now, because the pocket started very small, but has grown and grown and grown. Am I being too optimistic here, or do you think that's actually going to happen?
I share your optimism, but I think that if I can challenge you a bit, I think that the solution is not, like right now we're in a situation where you have AT&T and you have Verizon, but if you're on Verizon, you can't send to AT&T. And I don't think we should be sitting here being like, I hope Verizon gets big enough. What we should be doing is saying, I hope Verizon can send to AT&T. And I think that requires solutions, and we spend a lot of time thinking about this, that lean into being interoperable. The way we've set up PocketHealth is that any other image exchange can push into us or pull from us without our consent or often even knowledge. We support DICOM, both the obviously file type and protocol, and that's like I think that one of the great things about imaging is that unlike other things like HL7, like things are quite standardized. And we leverage that in everything we do. We hope other image exchanges do as well, but it's a little bit of game theory, but we've decided to lean in and say, look, if we get taken advantage of, at least we've taken the first step in being interoperable. And it's also about making sure that you can use our system and you don't have to worry if the person on the other side is on PocketHealth or not, whether you're a patient or a provider. So I am very optimistic because I think that we've seen that it is getting better, not worse, but it's not getting better because networks are growing. It's getting better because like slowly different networks are able and willing to share with each other. And partially my last point is because health systems are kind of making them, saying, look, I'm not going to, enough's enough. Like you have to be able to accept data from this other provider.
Ram, any comments on it?
No, I think Rishi said that perfectly. I think, I'm engaged on the academic side with Society of Imaging Informatics, and I think we're all thinking about it. We're also academically also demanding it. The folks who are in that sphere, my colleagues all across the country and the world, leaders like Dr. Tessa Cook and Adam Flanders, others. I think we all see this as a need, and I think if our leaders in this space of informatics are also thinking like that, health systems are thinking like that, it's nice to see that industry partners are aligned.
Now, Rishi, you mentioned it, but I got to ask, I understand you guys have done something new with image sharing. Is that right, at PocketHealth?
Yeah, we've really pushed the envelope in terms of the role that image sharing can play. Our fundamental belief is that image sharing is about continuity of care. It's about care coordination. Images don't go somewhere for entertainment. They go somewhere because the patient is getting treatment and their physician needs it. Or the patient wants access, again, not for fun, but because they know that at some point in the future they will have treatment. So we've really taken that idea and pushed it to the next degree, saying that what are we trying to do? We want to make sure, one, we launched Physician Hub this year. So now physicians can get access to their own accounts to all the images they want, including direct querying into the PACS systems that they've been authorized to query into. And then also we've launched Follow-Up Navigator, where now from PocketHealth, clerical staff are able to see in real time our AI detecting follow-up recommendations, both explicit follow-up recommendations and implicit ones that clinical guidelines like BI-RADS or Fleischner pick up, puts them into a work list, auto messages the patient, and even when messaging the patient, convinces them why, or explains to them why this imaging or follow-up or this biopsy or this urology consult might have been recommended by the RAD in the first place. So really expanding what image exchange can be, and running with the idea that it's being moved for to connect care. So how do we move that even further?
And how is Pocket Health helping to improve the collaboration between referring physicians?
Yeah, really from a referring physician standpoint, we've gone all in on Physician Hub. So like I mentioned, we now have this platform that physicians can go get access to their images on, query directly. They can break the glass if they need to with all the audit trails and all the capabilities. And then what we'll be doing next is also embedding clinical intelligence. You often have folks who are ordering imaging who aren't necessarily specialists in that type of imaging, or certainly not as specialized as perhaps the reading radiologist. And we think there's steps we can take, just like we've empowered patients, empower these referring physicians to understand what they're looking at a bit better, and help them gain even more stickiness with their imaging provider.
You guys have shared so much great information with me today. Ram, let me ask you, where can people go to learn more about UC Health?
Yeah, UC Health, it's based out of Cincinnati, Ohio, uchealth.com. And University of Cincinnati is the academic partner. So look forward to it.
And Rishi, where can people learn more about Pocket Health?
You can go to PocketHealth.com, and you can also reach out to me at rishi@pocket.health. And I would love to hear feedback, comments, concerns, and love to just connect with like-minded people who are trying to move imaging forward.
Well, amazing. Well, thank you so much to both of you for being on the program today. Really appreciate your time.
Great. Thanks,
Thank
Colin.
you.
Hey, I really want to thank Rishi and Ram for joining me on camera. It was really interesting to learn about UC Health's journey with Pocket Health and the problems that they were trying to address with that solution. I also appreciated the insight that Rishi was able to give to us on how Pocket Health is really leaning in to patient engagement in a way that doesn't add any burden on clinicians like Ram. And yet still, even though they're addressing patient experience, they want to still address the image interoperability challenge, which the company has always been known for. And hey, if you enjoyed this interview, please mash that like button and click subscribe. Also, head over to healthcareittoday.com, where you will find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.